My name is Rashmi Halker Singh, and I'm the deputy editor of Headache. I'm joined today by two of the authors of a recent publication. It's a research letter entitled Safety of Remote Electrical Neuromodulation, or REN, for Acute Migraine Treatment in Pregnant Women, a retrospective controlled survey study. So, welcome to Dr. Nina Riggins and Dr. Addie Peretz. Thank you for joining me today to talk about your work. So, first of all, can you tell me why you decided to study treatments in pregnancy?
Yeah, thanks so much for inviting us. We're excited to highlight this topic. I think in general, we know that the treatment of migraine in pregnancy is really understudied. We really don't understand the safety and efficacy of a lot of our treatments. And our patients have a lot of questions about this. And so patients will come in. Many of them are thinking about not conceiving because of their history of migraine and fears about migraine in pregnancy, or fears about what medications may do to pregnancy outcomes. And so this is an underexplored area that we wanted to tap into and learn more about. I think the best we can do with our patients is to give them the information, talk about the risks and benefits, and figure out what they feel comfortable doing to manage migraine in pregnancy. Many of them will experience an improvement, so that's great news. But for those that don't, it's really helpful to have a plan of action for how they're going to manage migraine. And with more focus on the safety of migraine and the safety of treatments for migraine in pregnancy, I think we'll better be able to help our patients through this kind of very vulnerable time. So that's kind of some of the rationale for why we approach this important topic. There's also really no studies looking at neuromodulation safety in pregnancy, and so this was one of the first that will kind of hopefully start a movement toward understanding this area better. A lot of us in the headache world, I think, are using neuromodulatory devices in pregnancy, even though it's kind of off-label, or we have patients asking us about it, or not wanting medication, but wanting non-pharmacologic treatments, and this can be one of them. And so finally, we're starting to give it a little bit more attention and study it formally.
Yeah, I mean, we were just talking before we even started this recording how all three of us are clinicians. We take care of a lot of women who are pregnant, and they're constantly asking us for questions about what happens during pregnancy and how to manage migraine if it doesn't improve. So I think those are really important points. So, Dr. Riggins, can you tell me about this project and what did you all, what did you guys do?
Yes, thank you so much. So we actually decided to create more evidence-based treatments and looked at control group and look at group who already used from database Nerivia as acute treatment for migraine attacks, and then compared both groups. And we were thrilled to see that there were no different negative outcomes for the group who used Nerivia, remote electrical neuromodulation, for treatment of their migraine during pregnancy. And we look through the period time of pregnancy and 3 months after pregnancy. For pregnancy, we did get pretty good enrollment in our study. So 140 people were eligible and completed all data points. And it was 59 people, participants, who were in group who used device. And statistics analysis showed us that it really were no safety signals for this group. And I let Dr. Addie Perez tell a little bit more about our primary and secondary aid points.
So one question, did the control group use any kind of sham device or did they had no device at all? And was it,
Control group,
yeah,
no.
no device. Okay,
No device. It was a retrospective survey study, and so
got it.
we were just asking them after the fact, how did pregnancy fare? Prospective in the sense that we did have data about use of the device during pregnancy,
Okay.
But not for the control group. The control group didn't have a device.
And they
Um,
used it acutely, not preventively, right?
yes,
Okay.
at the time that we did this study in the survey, it was only FDA cleared as an acute treatment, but now it's FDA cleared as a preventive, which is great. Um, So in terms of the endpoints that we looked at, we did kind of collaborate with obstetricians and gynecologists to identify what are the endpoints that are going to help us understand safety in pregnancy. And what we saw is that for primary endpoints, gestational age of delivery is really important. And then we looked at a number of secondary endpoints related to pregnancy outcomes. So newborn birth weight, miscarriage rate, preterm birth rate, birth defect rate, developmental milestones rate, and ER visit rate. And so we looked at all of those and didn't see any statistically significant differences between our control group of women with migraine who didn't use the device in pregnancy and the women who did use the device at least 3 times in pregnancy, which was, I think, to us, not very surprising news. I think many headache specialists are kind of theorize that these devices are likely safe in pregnancy, but now we actually have the data that we can point to and say, hey, this has been studied in pregnancy. We have looked at it to an extent, and we see that this is likely a very safe option for our patients to be using if they need treatment during pregnancy.
Awesome. So, how do you see this going forward? We have like a retrospective safety study now. What do you think we need to do next to add to the care of patients who might be pregnant looking for treatment options?
Yeah, we definitely bring up points from this study and upcoming publication that it's more knowledge now for this population who really need more treatments available to them. And now we hope that probably other treatments, other devices also need to be studied. So we see a lot of future for neuromodulation in population of people who we really don't want any side effects, such as pregnancy, breastfeeding, and sometimes even as additional therapy for other population. If someone has problems with liver, kidney, that is such a great option. So there is a lot of future for these neuromodulation devices. And I hope that we will get a lot more evidence-based studies and data that we can offer to our patients.
Wonderful. Well, thank you so much for taking the time to speak with me, and thank you so much for the work you do both clinically and in the world of research.
Thank you.
Thank you.